if you were to pull back at the first instance of any symptoms in anything you did, right? Like if I was to, um, I don't know, if I was to do exercise and I were to stop as soon as I started breathing heavy, like would I ever really get in shape? Well, no. I have to get to the point where I'm like I can't even go any further, and then I go another, few hundred feet, and then I go, okay, that was good. I kind of pushed myself. I didn't go crazy. Like I wouldn't just go out and run the whole marathon, right? I would start slow and work my way up.
Right.
That's one way to think about it. Um, so literally, the symptoms are the way to guide you. If something makes you dizzy, right, and you've had everything kind of checked out and you know that it's not like a serious thing, and a lot of people get worried because they're like, well, the doctor didn't even do a CT scan or MRI or any of that stuff, and so they're worried there's something seriously going on. When you have something that requires a CT scan or MRI, it's pretty obvious. Like no, it's very difficult for a doctor to kind of miss that stuff. Like it's usually pretty obvious. Like you come in and your face is drooping. Like it's like there's something going on there that's more serious. And if they don't send you for that, it generally means that you're neurologically intact and there's no reason of suspicion that you would
Hmm.
need that stuff. But as long as you've had the main kind of things ruled out and you're not like serious complaints, normally it's like, okay, that makes me dizzy. Okay, guess what? You're going to go do more of that. The common example is like crowds or shopping malls or grocery stores, right? I,
Hmm.
I can't even step foot in a grocery store because it makes me symptomatic. So then what do? You respond by not doing that, right? I don't go to the grocery store. My husband goes to the grocery store, or I don't go to the grocery store. I order online. I do click and collect, and I get my groceries delivered because I don't even want to go to the grocery store. Or even worse, I order Uber Eats every night and eat like crap. Okay, well, if you're gonna not go to the grocery store, how do you ever think you're gonna be able to step foot in a grocery store? Right? Like that's like,
Hmm.
I want to learn how to swim, but I don't want to get in the water. What? Like it
Yeah.
doesn't work that way. I don't care what anybody says. It just doesn't work that way. So what I talk about is tolerance, right? The same thing with exercise. If I'm going to
Hmm.
run somebody on a treadmill test and get them exercising, I want to find out where their breaking point is, right? When do your symptoms get worse, right?
Hmm.
I don't care that you're symptomatic now. I want to see at what point your symptoms get worse. So what do? I put you on the treadmill. I slowly rack up your heart rate until
I
you go, oh
remember
my
that.
God, yeah, right. So, oh my God, I can't
Yeah.
continue. And what we're looking for is like a good chunk of a good increase in your symptoms. So not just like, oh, my symptoms, oh, I have a slight headache. No, no, no. I want a 3 or more point increase in your symptoms from before you did that thing. So if you come in and tell me that your symptoms are a 5 out of 10, I'm not stopping the treadmill until they're an 8 out of 10, right? Not a
Right.
6 out of 10. I want to see like where is your breaking point. So then the same thing applies to anything, grocery stores, like name it. Like that's the thing. So if grocery stores make you symptomatic, what are you going to do? Well, there's got to be a point. It's not as soon as you walk into the grocery store, you're having, you're everywhere, right? Walk into the grocery store and walk, do one lap and see how you feel, right? Do your symptoms go up by 3 or more points? If not, stay put. Keep doing
Keep
that. Okay.
going.
Once your symptoms hit 3 or more points, you leave. And then you go, okay, how long was that? Oh, I was in there for 10 minutes. Great. Okay. Do that. Now go in for the next week. I want you to go every day for 9 minutes. Okay. You're below your threshold. You're going every day for 9 minutes. You're gradually exposing. Then 1 week after you first tried it, you're going to go in and you're going to try and challenge yourself again. Stay for as long as you can until your symptoms go up by 3 or more points. Now you can get to 20 minutes. Guess what? For the next week, I want you to go every day for 19 minutes, right? You're below your threshold. Then you do that for a week. The next week, go back in, try to stay as long as you can again and figure out when it is. Okay, 3 or more point increase. Now I'm at 30 minutes.
Hmm.
Now you can go for 29 minutes. Now you can do all your groceries because you can actually be in there for 29 minutes, right? You're not just saying, oh, that makes me symptomatic, so I'm not going to do that. You're saying,
Right.
how long can I do that before I get symptomatic? Then let's slightly pull back on that. So I know that I'm in a safe zone and I can do that for a bit. Then every week, challenge myself to try and do as much as I can again, see where I land, and then pull
Hmm.
back slightly from that, right? But that's the difference. That's the difference.
And I think that the difference for that too is a big shift in your mindset as well. Because it's so easy to say, I can't do that, or that gives me so many symptoms. It fires up my symptoms. I don't want to do that, or I'm too scared to do that. And I think it's easy to say that, but I lived through that too. When I was experiencing my concussion, I remember coming to see you and you're like, what the heck? How have you not done any of this for all this time? But I think it's kind of like the worry of, oh my gosh, if I do that and I get worse, I feel like I've made just a little bit of progress. I don't want to move back.
Yeah.
But also for me, the best example of that is when I started to do exercise, it was under your guidance when you were still treating me as well. And I remember starting yoga classes. And for me, I never considered yoga or Pilates or any of that, but I started going to those classes. And for me, I went to the 1 hour class and I was only active for about 5 minutes, 10 minutes for the first couple of weeks until I kind of got used to the way of doing things. I was dizzier. I was a bit more disoriented. It did fire up my symptoms, and I did have moments of panic, but it was kind of reassurance, kind of coming back on those weekly visits to say, no, 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 that's normal.
Hmm.
And I think we sometimes need that because you have, I had that like that fear in my head. Oh no, like what if I get worse? But it is a part of the recovery treatment and for the process. And I think it was by the end of December of the same year, I was doing sometimes two classes in one night. So
Mm.
the tolerance, I think, it does take some time, but when you get there, it's very rewarding
Right, for
and it
sure. And I
helps with the
think
process.